and other interesting clips. We have more than 300 videos covering various aspects of Indian experience here in Houston and from around the world. So please visit YouTube and subscribe to All India Radio Houston page so we can keep you updated as to the latest additions to our video blog. Good morning, ladies and gentlemen. This is Dr. NIK NIKAM. Welcome to All India Radio Houston, and we are going to talk about women and heart disease. Yes, indeed, women and heart disease is a very important topic. That's why the American Heart Association has designated the month of February as the Women and Heart Disease Awareness Month. And in fact, yesterday, Friday, was the Go Red Day to recognize women and heart disease as a leading cause of death among women. Yes, indeed, heart disease is the leading cause of death among women. So much so, 1 out of every 3 deaths among women is related to cardiovascular problems. And compare that with women dying from breast cancer. Only 1 person out of 31 deaths is related to breast cancer, whereas 1 in every 3 person who is dying has cardiovascular problems. So this is a major health issue when it relates to women. And there are 43 million women who have cardiovascular problems, diseases related to the heart, vascular system, and many other things. Heart disease among women are quite different from heart diseases among men. Let's talk about there are some pluses and there are some negatives. Looking at the positive side of being a woman, during the ages 20, 30, 40 and 50 or up to menopause, women have a lower incidence of heart disease compared to men, which is most likely attributed to their estrogen levels, which are supposed to be protective against heart disease. However, postmenopausal women have the same risk of heart disease and complications as compared to men. And there are some studies which show that women have the same degree and severity of heart disease compared to men, except they get them 10 years later compared to men. So that's one of the major differences. That is on the positive side. And some of the differences that are on the negative side, which we're going to talk about now, and that has to do with the way women are diagnosed with heart disease. First of all, women are less likely to seek help for cardiovascular problems, and less importance given to female patients' symptoms when they present with chest pain. It may be just written off as gastritis, stomach or gallbladder and everything else before they are evaluated for cardiovascular problems. But it is important for each person with symptoms of chest pain, heaviness, shortness of breath, tightness, or any kind of discomfort you have in your chest that needs complete cardiovascular evaluation, and we'll tell you what are the things that need to be done to rule out heart disease among women. Women also have an interesting phenomenon which is quite different compared to men. Women have small arteries in the heart, which makes it very challenging for treating these patients, because when you have large arteries, it is easy to put stents and bypass surgeries, grafts and things like that. But when you have real small arteries, the stents may not last longer, and the bypass grafts may be difficult to insert, and sometimes they may not work. The other important point that is negative when it comes to women and heart disease is a lot of these women also have maybe the main arteries are okay, but they have what is called the microvascular disease. That is, the tiny little arteries inside the heart may have some blockage, which may not show up on conventional angiograms or conventional stress tests, but nonetheless these patients have symptoms which make it very difficult to diagnose. So that is called the microvascular disease, which is a major challenge in recognizing female patients with symptoms where tests may not show exactly what we are looking for. And now the major risk factors for heart disease among women are very similar to those among men, namely cholesterol, especially LDL, which is the bad cholesterol. And interestingly, women have high levels of HDL, or the good cholesterol. And the other important point that we see among women, which is more often abnormal than in men, and that is the triglycerides. The triglycerides are generally not an independent risk factor, but more importantly, when it is combined with other conditions like diabetes, hypertension, obesity, then the triglycerides become an important additional risk factor for heart disease. So it is very important to get a complete lipid profile and look at the breakdown of each one of these components and see how they fit in a given individual with a combination of other conditions which I talked about, like hypertension, diabetes, obesity, family history, smoking, among other things. So the cholesterol is one we talked about. Smoking is another major risk. Smoking is the number 2 risk factor for heart disease. People who smoke have a twice the incidence of heart disease, heart attack. And those who stop smoking can reduce their risk of subsequent heart disease after 1 year of smoking by almost 50%. So there is a significant benefit in quitting smoking, especially if you have other major risk factors such as hypertension, diabetes, high cholesterol, among other things. Now let's talk about blood pressure. Blood pressure is also a very important risk factor for both men and for women. Blood pressure is also an important factor because blood pressure increases the risk of stroke by almost 60%. If we can control the blood pressure in an adequate manner, we can reduce the risk of stroke by almost 60%. Hypertension also adds to the risk of heart disease by almost 15%. So by treating hypertension, not only are we reducing the risk of stroke, but also reducing the risk of heart disease, and third and most importantly, we are reducing the risk of kidney failure. So there are multiple benefits to treating a patient with hypertension, being whether it's a man or a woman, in terms of reducing the incidence of stroke, heart disease, and kidney failure. So those are very important aspects that we need to keep into mind. Now let's talk about obesity. Obesity is a major problem among all adult patients, and it may be more so among women. And the distribution of fat may be different in men and in women, but overly obese patients have been shown to have high levels of triglycerides, higher levels of cholesterol, higher incidence of hypertension, higher incidence of diabetes, all of which are multiple risk factors, major risk factors for heart disease, and as a result, they all add up to increase the risk of heart disease. That is why 1 out of every 3 women who die, they die from cardiovascular disease, because all these factors combine together to increase the risk of heart disease to a significant degree. Now let's talk about diabetes. Diabetes is a major risk factor among men, and diabetes is a major risk factor among women. Why? Because of obesity, because of high blood pressure, and because of high cholesterol. Diabetes adds a significant risk factor for cardiovascular disease. And also people with diabetes have also been shown to have increased incidence of microvascular disease. And that also adds to the symptomatology and also for recovery from any kind of procedures. Diabetics, the moment someone has been diagnosed to have a full-blown diabetes mellitus, he's supposed to have the same risk factors as a patient with diagnosed coronary artery disease. So if you have 2 or more risk factors, it is absolutely essential that you get a complete, thorough cardiovascular evaluation and optimize your medical treatment so that you can reduce the risk of cardiovascular events such as heart attacks, heart failure and arrhythmias and things like that, but also improve your quality of life. Okay, let's talk about tests. What kind of tests do we do in our office to diagnose cardiovascular problems among men and women? We start off with an electrocardiogram, and we do an ultrasound test to look for heart size, the thickness, the valve, and if there is any evidence of heart enlargement or fluid around the heart. Then we do a blood test to look for cholesterol, the total cholesterol, the triglycerides, the LDL, which is the bad cholesterol, and also look at their thyroid, their blood sugar, their hemoglobin A1C, which tells us how far their diabetes has progressed, and all the other things that will enable us to pinpoint as what is the most appropriate treatment that is suited for that particular individual. And we also do nuclear stress tests to see if there is any evidence of a blockage that needs more attention in terms of intervention such as cardiac catheterization or coronary angioplasty or surgery for that matter. And once we have established these diagnosis with the test, then we proceed to the treatment. The American Heart Association recommends a very specific outline for treatment of patients with heart disease, be it men or women. Any person over the age of 40 years, it is recommended that you take aspirin 81 to 165 milligrams to reduce the risk of blood clot formation or sticking of the platelets, which causes blood clot. And based on other medical conditions such as high cholesterol, for which you have to take cholesterol reducing medicines. If you have blood pressure, you need to take blood pressure medications to reduce the risk of stroke, heart disease and kidney failure. And if you have diabetes, you need to strictly control your diabetes to reduce the risk of all other conditions such as hypertension, kidney failure, or heart disease, stroke and vascular disease in the legs and in the toes. So that makes it important. So let's talk about in the next minute or so that is left. You need to keep your total cholesterol below 200. You want your triglycerides to be below 150, and you want your HDL, the good cholesterol, to be more than 40, and you want your LDL, the bad cholesterol, to be below 80 milligram percent. So this is like a crash course on treatment, recognition and treatment of women with heart disease, but I am going to be giving a very extensive presentation on women and heart disease right here in Houston on February 22nd, starting at 10:30 p.m. at Jane Center, located on 3407 ARC Street in Houston, Texas. For further information, you can contact Ashok Singhvi, Shingavi, and his number is 713-789-2338. I am Dr. NIK NIKAM, and you have been listening to All India Radio Houston. Thank you so much, and we will see you next Saturday at 10 a.m. Thank you.
Ladies and gentlemen, you are listening to All India Radio Houston on 1090 AM.